California is about to give nearly 250,000 undocumented immigrants access to government health care. It's part of the new state budget that passed the legislature and is now awaiting the governor's signature.
Our ABC 10 News anchor Derek Stahl is going in depth on what will be the most expansive coverage in the country for people without legal status.
I get my client ready for the day.
As a home care worker, Emily helps her client with all kinds of tasks. She asked us not to use her last name.
Prepare her food, her medicine.
But as an undocumented immigrant originally from the Philippines, the 62-year-old is on her own when it comes to her health. Her status bars her from government health insurance and the private plans on covered California.
Right now, I'm seeing doctors, then spending out of pocket for my doctor's fee. We are the caregivers, and yet when we needed care, we could not get our own care. Very, very ironic.
Under California's new state budget, undocumented immigrants age 50 and up will now be eligible for Medi-Cal, the state's version of Medicaid. They'll get full coverage as long as they meet income requirements, less than about $36,500 for a family of four. Previously, they only qualified for restricted coverage for things like pregnancy and emergency care.
It's great that we are willing to save people on their deathbed, but it'd actually be a lot more cost effective to just let them get an annual checkup and catch things early before they become expensive, costly, require procedures.
Sarah Dar of the California Immigrant Policy Center says the expansion is a logical next step for the more than 2 million undocumented immigrants in the state. In 2016, California gave Medi-Cal to undocumented kids under 19. Then last year, it became the first state to expand to those under 26. That covered about 200,000 undocumented immigrants at a cost of $565 million a year. The latest expansion to the 50-plus group will make another 235,000 people eligible. But care for older people costs more, so it'll cost the state another $1.3 billion. Altogether, it's less than 1% of the state's $262 billion budget. Polling shows 2/3 of Californians support health care for people without lawful status, but 80% of Republicans disapprove, saying the money would be better spent on something else.
The contributions of undocumented Californians are no less than anyone else, whether it's economic, whether it's through taxes, whether it's through their labor, whether it's through their contributions to the social fabric of our state. This is really just about treating everybody equally and fairly. And I think it will benefit everyone.
Dar says the pandemic was the ultimate reminder that everyone's health depends on the health of those around them. Derek Stahl, ABC 10 News.
And once signed by the governor, that new coverage will start in May. Advocates say that they will begin pushing to get the last group of undocumented immigrants covered by Medi-Cal adults 26 to 49.